This video has been produced for staff working in the Northern Community COVID Centres. Community COVID Centres are being established to protect community services and staff and to ensure that as far as possible face-to-face management of patients with potential COVID-19 virus infection is managed outside normal GP practice and out-of-hours sites. Community COVID centres will be fully equipped and enable the appropriate management and care of potentially infected patients while ensuring staff and patient safety. Changing facilities, showers, personal protective equipment, cleaning procedures, infection control measures and appropriate protocols have all been put in place. The Community COVID Centre will run from 8 AM to 10 PM 7 days a week and will see patients in the centre. Home visits can be arranged and details of this service will be provided separately. Patients will be seen by arrangement only and initial triage will take place in daytime general practice or in the out-of-hours service. It is essential that triage is accurate, complete and robust as capacities in the centres is finite and they could easily be overwhelmed by inappropriate referrals. All calls to centres will be seen routinely. There are no urgent category of calls. Patients will contact their GP practice or out-of-hours provider, which is Dalriada Urgent Care in the Northern Trust area, in the usual way. After triage, patients fulfilling the criteria for potential COVID-19 infection will be categorised as green, amber or red. The majority of patients will be in the green category and have minor symptoms. They can be safely managed with advice and treatment by their own practice without the need for a face-to-face consultation. After triage, some patients will be categorised as red patients. These patients are seriously ill and fulfil the criteria for hospital treatment. They can be referred directly to the hospital using agreed pathways and after appropriate notifications have taken place. Amber patients are those patients who fall somewhere in the middle and require a face-to-face assessment because of ongoing illness, deterioration or diagnostic uncertainty. It is these patients who should be referred to the Community COVID Centre. It is important to note that the Community COVID Centre does not provide testing. Patients are referred to the Community COVID Centre via the CCG computer system in practices or directly from out of hours in the usual way. When making referrals, it is important to include a mobile telephone number for the patient to enable contact with the patient, both to arrange their appointment and to facilitate their entrance to the centre. A number of centres are planned across the Northern Trust area. GP sessions will run from 8 AM to 1 PM, from 1 PM to 6 PM and from 6 PM to 10 PM daily. The same pattern will run in each centre to facilitate management of the system and allow interchange between centres if required at times. Each practice will be randomly allocated sessions with a fair division between in-hours, evenings and weekends. It is the responsibility of the practice to provide staff to work in these sessions. All equipment required will be provided in the consultation rooms in the centres. The rooms and equipment will be cleaned after each patient by the on-site cleaners. Scrubs, personal protective equipment and towels will also be provided for all staff. GP federations are organising the practice rota and details of practice sessions are available on the Dalriada Urgent Care website, dalriadaurgentcare.org.uk. Sessions will show 2 boxes per session on the website. The upper box will detail the practice name and the lower box can then be populated with the name of the actual doctor working the session. If there are concerns about allocated sessions, the Federation office should be contacted by email. Patient referrals will be received via CCG from practices. Details will then be transcribed to the Ad Astra system, which is the out-of-hours GP system. Staff who have not previously used Ad Astra will be shown how to do this. They will also require a password which will be given to them at their first session. Staff should report for duty and collect a change box. This contains a towel and a plastic bag. Please do not bring valuables to the centre, and we also recommend that you do not bring food. Tea, coffee and snacks will be provided. Please proceed to the shower unit or changing area where you can change into your scrubs and place your clothes in the box provided. You should then enter the Community COVID Centre and put on your personal protective equipment as per instructions. Having cleansed the hands, put on the apron by placing over the head and tie at the waist. Put on the face mask, position upper straps on the top of the head and lower straps behind the neck. With both hands, mould the metal strap over the bridge of your nose to ensure a tight fit. Put on eye protection. If you wear glasses, a facial shield should be worn. Otherwise, the protective glasses, which are reusable, can be used. Finally, put on gloves. Between each patient, the gloves and apron can be changed, but the mask can be worn for the duration of the session. The facial shield can also remain in place for the duration of the session. Taking off personal protective equipment. To remove the gloves, grasp the outside of the glove with the opposite gloved hand and peel off. Hold the removed glove in the remaining gloved hand. Slide the fingers of the ungloved hand under the remaining glove at the wrist. Peel the remaining glove off over the first glove and discard. Cleanse hands. To remove the apron, unfasten or break the apron ties at the neck and then let the apron fold itself down or roll it down on itself. Break ties at the waist and fold the apron in on itself. Do not touch the outside of the apron as this is likely to be contaminated. Discard the apron. Remove eye protection and clean hands. Remove the face mask once the clinical work is completed. Do this by untying or breaking the bottom ties first, followed by the top ties, and then remove by handling the ties only. Take the mask down and away from your face. Discard the mask. It should not be reused. Finally, clean your hands with soap and water. After each patient consultation, the surgery which has been used will be vacated and cleaning staff will be on hand to clean the area. At the end of your session, please return to the shower changing area, remove your scrubs and place them in the plastic bag provided. Shower and change into your normal clothes. Liquid soap, toiletries, etc. will be provided. When leaving the shower changing area, please deposit the plastic bag with your scrubs in the laundry bag provided. You should not leave the centre in your scrubs as this presents a risk of potential contamination. Protocol for seeing patients. Patients will be invited to the Community COVID Centre following referral. They will be given a specific time and asked to remain in their car in the car park until contacted. They will be asked to attend alone where possible. At the appropriate time, they will be contacted and asked to approach the centre, where they will be met by a healthcare assistant who will bring them into the centre and offer them a mask and advise that they cleanse their hands. They will then be shown to a surgery where they will have their observations recorded and news score calculated. The patient details will be available for the doctor on the Ad Astra system. The doctor will make an assessment of the patient using the equipment provided in each room. No unnecessary examination should be undertaken, and we suggest that you take care if you wish to examine the throat. A plan of management will be agreed for the patient. If this involves onward referral, the appropriate referral pathways should be followed. Details are available in each centre. If the doctor wishes to prescribe medication, a complete course should be given from stock. The healthcare assistant or doctor will remain in the consulting room, and a colleague will bring the medication from the medication store to the consulting room. Handwritten prescriptions are also available should the doctor wish to prescribe something that is not available from stock. Following the consultation, the healthcare assistant will escort the patient from the building. The doctor will complete the consultation details on the Ad Astra system, and the doctor will then leave the surgery, which will then be cleaned. The available equipment includes a thermometer, otoscope, stethoscope, BP cuff, and pulse oximeter. A standard range of medication is available, similar to that in out of hours. CPR is now considered a non-aerosol generating procedure, and as such, chest compressions and defibrillation can be commenced with the existing levels of personal protective equipment.
We appreciate you taking the time to watch this short video and hope it has been helpful for you. We want to make this a positive experience for you. We welcome any feedback from you. Thank you and enjoy your shift.